All right, so next we get to generate solutions. So this is where we decide, what can I do? What am I going to do about this? Okay, so we have all these actions to take, and remember that we might do all of these for any client, but we have to find the two that are most likely and going to help with our uterine atony. So the first thing I like to do is think, what's my goal with uterine atony? What am I trying to do? So what are we trying to do? What's our goal? What kinds of interventions do we want? We want to look for interventions that are going to slow and control the bleeding, right? Do we all agree? So let's keep that in mind as we go through all of our interventions. So let's see. Posh is on it. So she's saying administer oxytocin and perform fundal massage. So let's take a look at all of our options here. So actually, let me show you all this image that we have. So these are, for postpartum hemorrhage, our causes and our interventions. So there are 4 T's of postpartum hemorrhage. Tone, that's our boggy uterus. That's what we got going on, right? We have trauma. We have tissue or thrombin. So trauma would be like a bad tear that's maybe unrepaired, tissue, retained placenta, and thrombin would be like our DIC. Trauma would also be our hematoma. So now we can look at what kinds of interventions we're looking for, because not all postpartum hemorrhages are treated the same. So for our tone, we are going to be looking for doing fundal massage, giving oxytocin, carboprost, or misoprostol, just medications that would firm up that uterus. So keeping that in mind, we'll take a look at all of our options. So oxytocin, what is that? Oxytocin is a uterine stimulant. So what does that mean? It's going to help firm up and contract that boggy uterus. We definitely need that, right? I think administer oxytocin, but let's keep looking. The next is perform fundal massage. This is what a fundal massage looks like. And keep in mind, because this is a question that the NCLEX loves to test on too, is how we are positioning our hands for these fundal massages. You want to have one supporting hand underneath the uterus with one massaging hand on top. This supporting hand is really important because it's going to keep the uterus in place so that you don't accidentally massage the uterus and push it out of the vagina and have a prolapse. We don't want that. So definitely we want to give these fundal massages, and you could be giving this fundal massage forever. It feels like, because you're doing it until the uterus firms up, till these medicines kick in. We had a postpartum hemorrhage at my job the other day, and we were trading off doing fundal massage for probably 30 minutes. So you definitely get a good workout in. All right. So looking at our other options, we have apply ice to the perineum. So would we want to do that, or when would we do that? We would definitely do ice to the perineum anyways for any vaginal delivery, but specifically if a client had a hematoma. Remember that applying that ice is not going to slow or control that bleeding, right? It's just going to be comfort. And then prepare the client for a manual uterine sweep. So when would we do that? We would do that if the uterus wasn't intact, right? The provider would go in and try to remove any clots or any retained tissue fragments. So we don't have a retained placenta. And then the last one, prepare the client for an abdominal ultrasound. So this is done when we can't figure out where the bleeding is coming from. If they need to take, an ultrasound, take a look to see, are there retained fragments in there, or what exactly is going on. So that is not needed for this client either. It's not going to help slow or control her bleeding. All right, so now we get to take action. So what do we decide on? We decided on performing fundal massage and administering oxytocin.